So really we were addressing the burden of hypertension and cardiovascular risk. We know that this is one of the biggest contributors, so hypertension to cardiovascular disease and mortality. And we know simple medications can lower blood pressure and improve outcomes, but they're not being used. We know the detection, the control, and the treatment of hypertension is low globally. We also know that cardiovascular disease is reduced with statins and those with hypertension, but their use is less than 5%. So trying to address these treatment gaps, we outlined the barriers to care, and this was a really important first step of the study where we did systematic reviews, health system appraisals within Colombia and Malaysia to truly identify what were the barriers to this management at the patient, healthcare provider, and at health system level. And with that informed our Hope for intervention, which was, as you mentioned, multifaceted. So it involved task sharing with non-physician health workers. We trained them through a curriculum that then they could use to go forward with tablets that enabled them to kind of go through counseling and simplified management programs to treat cardiovascular risk and diagnose it. We also provided combination antihypertensives as well as lipid-lowering drugs, statin. And then we also brought family into the mix. And so this was a key component which we feel really helped with adherence and healthy behaviors. They were the treatment supporters throughout this study. What's important is adapting this to the local context. So while we had these kind of core components, they can be adapted depending on your situation. And we do feel that this is something that could carry through from low to middle through to high income countries, depending on the barriers identified. We know in low and middle income countries, non-physician health workers are often at play, working in HIV, maternal health, other areas, and whether or not we could train them as part of our curriculum, which was only 1 week long, to help to tackle this burden of cardiovascular disease, which we know is a growing issue in low and middle income countries. In high income countries as well, particularly if you target lower SES populations where they may not have that same access to care, this is a reasonable way to approach that.